here. Cultural awareness and health practice, right? This is the chapter, cultural awareness. So means we are here from different geographical areas, immigrant, Native American, and also we have a different religion, different spiritual belief. The culture, religion, or spiritual belief influence our health, and also different culture or different religion have a different dietary habit and practice. If we know a little bit, it can help to deal with our patient, right? So as an example, like African American. Who are African American? Basically, the citizen or resident of United States who may have origin in any part or population in Africa. So what are the communication, how they communicate with us or with everybody? So members are competent in standard English, right? So in African countries, they can talk with different mother language, but we have a one common language. We can exchange our emotion, feelings, complaint by English. So, in African American, because of, during the communication, if anybody prolong the eye contact, may be interpreted as a rudeness or aggressive behavior. So long-term eye contact is not good, right? They said it is rudeness. So non-verbal communication may be important. Yes. How you talk, your body language, your way of walking, your posture, your way of standing. So your body has a language. You respect your patient or not, right? So body language also the way of communication. Your attitude reflects by your body language. So personal question asked on initial contact with a person may be viewed as an intrusive. So in this PowerPoint, definitely we will give a more focus on our health, right? Or belief related to the health. So it is, I want to tell you, whatever our religion, I'm Jewish or Orthodox, Hindus or Catholic or Islam, whatever my geographical identity, my skin color, whatever it is, as a RN or LPN, we have to respect our patient. We have to respect to their belief, whatever their belief and what is my belief, it's not a question. I have to respect them, right? So now go second page here. So time orientation and personal space preference. So time orientation varies occurring to age, socio-economical condition, and also subcultures and may include past, present, or future orientation. So maybe let for appropriate because relationship and events may be deemed more important than being on time. Members are comfortable with laws, personal space. So members are more comfortable with close personal space when interacting with family and friends. So yes, it is very general ideas, make sense. Members are feel comfortable with the close personal space when they interact with family. But when we talk about the health, we are LPN or RN. When you interact with your patient, first of all, you have to introduce who you are. Try to make a comfortable relationship with them. Try to make you truthful, trustable, reliable. Then they will share their ideas with you, right? Otherwise, they will not share their past or this life story with you. And we need it for a good medical history, for a diagnosis of the disease. So comfortableness is very important, right? So social roles, large extent family are important. Old adult are always respected. Even we like to teach our children how to respect the old person. Many households may be headed by a single parents women. Religious belief and also somebody is used to go to the religious space for prayer. So they believe this is the strength. African American, what about their religious belief? Religious belief profoundly affect the ideas about the health and illness. Food preference include such items as fried foods, chickens, pork they like to eat. African American. Some of the diseases are most common in African American. So like sickle cell anemia. Sickle cell anemia is most common, not thalassemia, sickle cell anemia. Hypertension, heart disease, cancer, lactose intolerance, diabetics, obesity, and insufficient intake of vitamin and minerals. So I said because of their lifestyle or genetic factor or environmental factor, this is the disease list are most common in African American people. So when we deal with the patient who origin from African American, how we have to deal with them, right? So always I said they have a different belief or practice. Whatever my belief or my practice, it is regardless. I have to respect their belief or their practice. So also assess the meaning of the client verbal and non-verbal behavior. Flexible, avoid rigidity. So if you are not easygoing, you are not flexible, it would be hard for you to adjust, to adapt. Always encouraging the family member to participate with patient daily living activities. So alternatives method of healing include herbs or meditation, prayer, or laying of hands practice. So definitely the main remedy is a pharmaceutical medication after a good doctor's counseling. But what are the alternative? Some people believe with herbals or herbs. This is called comprehensive alternative medicine. Some people feel good when they do the relaxation technique, right? It depends. So also assess each individuals for cultural preference because there are many individuals and subcultural variation. So now we are going to talk about another um, community or people. This is called Amish communities, right? So, so the Amish are known for simple living, very plain, ordinary dress up, or also they like they adopt the modern convenience and can be considered a distinct ethical groups. So some of the population living in Pennsylvania or Germany, right? So these geographical areas peoples follow same religious belief, most of them basically Christian. Also the Swiss, I mean, some of the people is called Swiss German. Okay, so and here it is important, they some of the disease are most common in these communities. Some of the diseases are most common, I said. Okay, so here the cultural beliefs and preference are very depends on specific Amish communities membership. In general, they have a fewer risk factor. Why few risk factor? Because of their food habit, because of their lifestyle, and because of their participation in physical activities. On the other hand, some of the diseases are most common in this community because of their um, marriage system or sexual abuse in the women. So risks for certain genetic disorder increase because of intermarriage Sometimes they're allowed to marry in second or third degree relationships. So most chance of baby develop with a genetic disorder. Sexual abuse of women, another risk factor. So communication, German or Pennsylvania, Dutch, they can spoken Dutch language, German language, right? English usually learned in school. Time orientation and personal space preference. Members generally remain separate from other communities. They are isolated, they are busy with them. They often work as a farmer or homemaker, builders, social roles. Women are not allowing or allowed the position of power in congressional organization. Means they're homemaking. They most of the time they work at home. Roles of women are considered equally important to those of the man, but are very unequal. So family life has they like the patriarchal structure. Marriage outside the faith is not usually allowed. Health and illness, our main focus about these communities. So most Amish need to have to go to their religious place, bishop or communities. So some of the barrier of modern healthcare include the distance to healthcare services, lack of transportation, cost, level of understanding regarding scientific technologies. So, but because of that advanced technology, because of internet, definitely now is not like the 1960 or 1980. Now it's changing everywhere. So health risks, genetic disorder because of intermarriage or non-immunization, they discourage the immunization. So baby most of the chance to develop the disease like polio, measles, mumps, flu. Women have a possible risk of sexual abuse. Here, now, when we give the treatment to this community, how you have to interact with them, right? So, as I told you, we have to respect whatever their religion. It is not a question whatever it is, but we have to respect them. Speak in the both husband and wife. So they about the health, husband and both discussion and then make a decision. It is good, right? Health instruction must be given in a simple way to explain or clear, transparent language. Teaching should be focused on the health implication associated with non-immunization, intermarriage, and sexual abuse issue. So when you teach them, when you reinforce them, explain if they do not take the immunization, what are the risk factor and what are the advantage of immunization, right? Like if your baby has to take the measles vaccine, they can prevent the disease, measles, they can prevent it. If the baby has to take the tetanus vaccine, they save for infection, BCG, hepatitis, polio. So also he has to explain them if they do the intermarriage, the baby has a chance of develop genetic disorder or disease like cystic fibrosis, Down syndrome, or also sexual abuse, chance of develop sexual transmitted disease or sexual transmitted infection. So be alert cause the regardless eye contact, personal space, time concept, and underlying of recommended plane of care. What else? American of Asian descent can include ethical groups such as, now go for another communities or group is called Asian American, right? So the people who came from Chinese, Philippine or Filipino, Indian, Vietnamese, Korean, Japanese. So from those geographical origin, we are tell them Asian American. So now next, communication. They have different countries have a different language like Chinese, Japanese, Korean, then Vietnamese, and English is a common language or second language. Each cultural group may have a barriers dialected of its languages. So when you talk to the patient, when you keep silent, it means you are interested to hearing. When you give them silent by keep you silent, when give you them time, they can organize their thinking, then verbalize their feelings. Eye contact may be considered inappropriate or disrespectful. So better don't do this, right? Criticism or disagreement is not expressed verbally. So the word no may be interpreted as a disrespect to others. So in this community, the silence is very valuable. Teaching is unacceptable. I mean, touch is unacceptable, especially with the opposite sex. Head is considered a scuffed. Do not touch the head, right? So next, time orientation and personal space preference. Time orientation is reflect the respect for past, but include emphasize on parents, present, and future. Formal personal space is preferred always. It is important. Keep a distance, and as I told you, they do not allow to touch, especially the opposite sex. So members usually do not touch each other during the conversation. For some culture, touching is unacceptable. Okay, and also the head is considered to be scared some culture on touching someone on the head may be disrespected. What are the social rules? Members are devoted to tradition, and large extended family network are common. Loyalty to immediate or extended family and respect are valued. Family unit is structured, and also men have the power on the family or authorities. Women are expected to be obedient. Education is viewed as important, religious, including the Orthodox, Hindu, Buddhist, Islam, or Catholic, right? Christianities as well. So social organizations are strong within the communities. So this is the question NCLEX board asks. So I put some different color. Health and illness. Health is a state of the physical and spiritual harmony with nature and balance between positive and negative energy forces. So they believe in two terminologies called yin, Y-I-N, and Y-A-N-G, yang. So basically, yin is dark and cold, and the yang means bright and hot. So they do not mix hot and cold together. If anybody have a cold disease, they give to hot food. If anybody has a hot disease like fever, temperature increase hot, they give cold food. If anybody has a cold disease like flu, sneezing, cough, they give hot food. So they prefer warm and consider good for wellness. So YIN, food are cold, and YANG, food are hot. One eats cold food when one has a hot illness, and one eat hot food when they have a cold illness. They believe and they trust it, and trust give you some mental strength and help to healing the disease. Psychology. So what are the common disease in Asian American? Heart attack, common like African American, hypertension, heart disease, cancer. These three also common in African American, like Asian American. Lactose intolerance, thalassemia, but African American, sickle cell anemia. Here the thalassemia is most common. So when we interact with them, what we have to keep in mind during intervention or interact with this patient. So be aware of an respect and physical boundaries. Always it is good to keep it in mind about your boundaries. It is good to take the permission if you need to touch. Like if you need to examine the pulse rate, heart rate, better to take permission, explain them what you are going to do, limit eye contact, avoid the gesture with hand. Female clients usually prefer a female primary health care. clarify responses to question and expected to the healthcare provider, and be flexible and avoid rigidity, right? So when you go easygoing or flexible, it is easy to adapt with the environment, interact with the other community peoples, and exchanging the ideas. Encouraging the family involvement in the services. Alternative models of hearing include herbal, acupuncture, the restoration of balance with food, massage therapy, offering the meditation can increase. Latino American culture, they may view the illness as a sign of weakness or punishment of a bill. So American, the past origin from Latin country like Mexican, Cuban, Colombian, Dominican Republican, Puerto Rico, right? All of the people from that country, we said Latino American. So the language include primarily English or Spanish, French language. Members tends to be verbally expressive also. Confidentiality is very important. Avoiding the eye contact with the person in authority may indicate respect and alternativeness. So direct comfort is usually disrespectful. So direct confrontation is usually disrespectful. And also expression of negative feelings may be impolite. So they may view the illness, as I told you, as a sign of weakness, right? And may consult with the the priest, the religious person, they like to consult or consult. Family members are typically involved in all aspects of decision, such as the terminal illness, or may see no reason to submit to mammogram or vaccination. Usually they do not. So what next? Time orientation and personal space preference. Members are usually oriented more to be present. Members may be late for appropriate appointment because relationship and events that are occurred are valued more than being on time. Members are comfort in close proximity with family, friends, right? And members are very tactile and use the use embracement or handshake, or members below the physical presence of others. So here, social roles. What are the social roles? Nuclear family, extended family is highly regarded. Need for the family take the precedence over the need of an individual's family member, and depends on age and also accuratation factor. Men are usually the decision maker. So I said typically family members are typically involved in all aspects of decision making, like terminal illness, right? So depends on age or religious. Usually their belief is Catholic, right? Or some are believe in Orthodox. So strong belief there, and social organizations are strong within the communities. Health and illness. Health may be viewed as a gift by the God or good luck, sign of good luck. And weak disease is the weakness or punishment by evil. So illness may be viewed by some member to be result of God punishment, and some member may adhere to the non-traditional health measures such as folk medicine, some of them. What are the risks of the disease? So like hypertension, heart disease, diabetic mellitus, obesity, lactose intolerance, right, are most common in these groups, Latin America. How we have to interact with them? So allow the time for the client to discuss the treatment and their treatment option, alternative, their diagnosis, each and everything. Give them time. So privacy is most important. Protect the privacy. Offer to call because of significant of religious preference. Ask the permission before touching. Flexible because to getting the information. Alternative models of healing include herbals or any other traditional way, like restoration of balance with a hot and cold food, prayer and religious. What next? Native American. Native American, who they are, and what are the difference with Western culture? Native American use peoples from North America, right? Include Alaska, Hawaii. So compared a large number of district, tribes, state, ethical groups. So communication, they have a, there is much diversity, depends on their origin. Silent indicate the respect, and some member may speak in a low tone of voice. Eye contact may be viewed as a sign of disrespect, or body language is important. Always, body language is very important. Native American, as I told you, they may turn into a medicine or may turn to a medicine man to determine the true cause of an illness, may value the abilities to endure the pain or grief with the silent. Diet may be deficient in vitamin D or calcium because many suffer from lactose intolerance or do not drink milk Obesity and diabetes are the major health outcomes in Native American. So members are oriented primarily to the present. Personal space is important. Also, massive may be used to newborn to promote the bondings. Message is important. And some groups may prohibit touching of the dead body. Social roles, members are family oriented, basic family unit is extended. In some groups, grandparents are viewed as a family leaders, elders are respected, honored, children are tough to respect the tradition. Father usually does all the work outside home. Mother do at home, domestic duties, homemaker. Most members adhere to the same form of Christianities and religious and healing practice are usually integrated. Community social organization are very important and Native American health issue. So health is usually considered a state of harmony. So state and health is usually considered a steady state of harmony between individuals, family, and environment. Some groups believe that illness is a caused by supernatural force and disequilibrium between person and environment. Traditional health and illness belief may continue to be observed by some groups, including natural and religious, and some groups food preferred include like fish, fruits, berries. So, what are the difference between Native American or Western culture? The Western culture basically value the technology and almost exclusively in the struggle to the disease. Health is understood to be the absence, also minimization or control of disease process, right? The Western culture are more technology based, but the Native American culture are more traditional, conservatives. The disease, what is the disease in Native American? Alcohol abuse, obesity, heart disease, diabetic, tuberculosis, arthritis. Tuberculosis is actually more common in the overcrowded communities and poor communities. Lactose intolerance is most common. Because of this, they have a deficiency in vitamin D and calcium because most of the people suffer by the lactose intolerance and they do not like to drink milk. Obesity and diabetic are major health concerns. So when we deal with the patient in these communities, how we have to interact with them, right? How we have to interact with them. So always we has to be honest, clarify the way of communication, be transparent, and also obtain input from member of extended family, encouraging the client to personalized space always in the home, assess for availability of the running water, modify the infection control, and also hygiene practice are necessary. Alternative models of healing include herbs, restoration of balance between the person and universal, and also consultation with tradition, the healers is important. Now go for white American. So what they are in the white American. So the basically the white American that used include US citizen or resident having the origin in any of the original people of Europe, right? So Europe, Middle East, or North Africa. Another way that we call them Caucasian American, Caucasian American. So communication, there are language include original English is their first language, but they also can speak their original language like Italian, Polish, French, Russian. Silent can be used to show the respect or disrespect for another. Eye contact is usually viewed as indicate the trustworthiness. So time orientation and personal space preference. Okay, so members are usually future oriented. So it about the white American, the time orientation and personal space preference. So member usually future oriented and also time is valued. Member tends to be time and also to be impatient with people who are not in time. And some members may tend to avoid the close physical contact, and even handshake are usually used for formal greetings. Social roles. Basically, nuclear family is the basic unit, and man is dominant figure. And also, community social organization are very important in white American or Caucasian. The health and illness. The health is usually viewed as an absence of the disease. So if anybody is healthy, means they are disease free or illness free. Many members usually have a tendency to be static or stoic when expression physical concern. And members usually rely the primary on modern Western healthcare delivery systems. So they prefer in science and technology, they prefer Western health or medicine. What are the risks of the disease in the Caucasian, like cancer, heart disease, diabetes mellitus, or obesity and hypertension? Intervention basically absence the meaning of the client, verbal and non-verbal behavior, respect the client personal space and time, be flexible and avoid the rigidity in casual care, or encouraging the family involvement. And now we are going to give a focus in end of care, right? In different religion or culture, what they think about end of care. So, like here, the people in the Jewish faith generally oppose the prolonging of life after irreversible brain damage. Jewish faith. Some member is Orthodox or Muslim or Orthodox Jewish. They prohibit autopsy. Like if anybody die and it is suspicious, need to forensic medicine, but they do not like for autopsy. Muslim permit the organ transplant if it is life-saving. Amish permit organ donation, but accept heart because they think heart is the soul of the body. And Buddhists in the United States encouraging the organ donation and consider it as an act of mercy. Some member of Orthodox or Islamic or Jewish faith discourage, oppose, or prohibit cremation, but Hindu prefer it. African American members discuss the issue with the spouse or older family member. Family is highly valued and is centered to the care of terminally ill member. Open display of emotion are common and also accepted, and members prefer to die at home. Asian family members may take decision about care and often do not tell the client the diagnosis or prognosis. Dying at home may be considered bad luck. Organ donation may not be allowed in some ethical groups. Latino groups. Family generally makes the decision. Extended family members often are involved in end of life care, and several family members may be at the dying the client bedside. Let you know what they think about end of care, the vocal expression of grief or expect acceptable and also expected. Members may refuse the procedure that alter the body, such as autopsy. Dying at home may be considered the bad luck. So, patient, if they get in hospital, they get actually better opportunities as like painless death. Native American, what they believe about the end of life care. Family meeting may be held to make the decision about end of life care or type of treatment. What are the alternative? What are the different options of the treatment, especially the terminal care? Some group avoid the contact with the dying or provide individualized and end of life care to the client and families. So this is the basic concept about the end of care among different religions and different groups.